Hello, my name is Ignacio Castro and I'm going to talk about transplantation of HCV infected kidneys into uninfected patients. Well, this is a surgical procedure to take place a healthy kidney into a person whose kidneys no longer function properly. But this specific type of kidney transplantation is typically classified as deceased or donor or living donor transplantation depending on the source of the donor organ.
Hepatitis C virus reproduces in the liver, causing inflammation and possibly cirrhosis, liver failure, or liver cancer, much like hepatitis B virus. However, HCV is different with its own traits. A person may be infected and have no signs or symptoms and can live with the virus for decades without even knowing it, while the virus does damage to the liver. About 80% of the people exposed develop a chronic infection. Remember, that means long-term. Only about 20% are able to clear the virus by naturally building immunities. There are about 3.2 million people in the USA infected with hepatitis C virus, with about 17,000 new cases each year. Deaths from chronic disease each year total approximately 12,000 people. Symptoms are not a reliable way to detect hepatitis C either. A blood test is usually needed. And if symptoms appear, they may look the same as hepatitis B, which again would include the yellow skin, otherwise known as jaundice, yellowing eyes, tiredness, loss of appetite, nausea, dark urine, joint pain, abdominal discomfort, and fever. Unlike HIV or HBV, HCV is spread primarily through contact with the blood of an infected person through needles. Hepatitis C virus is most commonly spread by sharing needles for injecting drugs. That's currently the most common means of HCV transmission in the US. Receipt of donated blood or blood products and organs. Once it was a common means of transmission, but now, due to the fact that there's much more screening available, it's much less a risk. Birth to an HCV-infected mother, needle stick injuries in healthcare settings, although this is also a low percentage of how HCV infections occur. And unlike HIV and HBV, hepatitis C is spread less frequently through sexual contact or sharing personal items contaminated with infectious blood, such as razors and toothbrushes. HIV-infected people face a much greater risk of HCV infection due to an already suppressed immune system. Now, there's no evidence of HCV transmission from food handlers, teachers, or other service providers in the absence of blood-to-blood contact. Like HIV and hepatitis B, it is not spread by casual contact like handshakes, hugging, doorknobs, or using the same equipment like toilets or water fountains, unless there's contaminated waste on those objects. There is no cure for hepatitis C, and today there's still no vaccination.
Application in medicine. This is a this is a trial that wants to take a infected kidney with HCV to turn it into with medication into a healthy no longer HCV kidney infected to take its place in a recipient. That's because more than 500 high-quality kidneys from deceased donors with HCV are discarded annually, and they want to take to administrate direct-acting antiviral agents have to create the potential to increase the number of kidney transplantation by making these HCV kidneys available.
I'm going to talk about the surgery of transplantation, the recovery process, and possible complication around the time of transplantation. Upon your admission for transplantation, you'll be seen by a doctor of the transplant team who will assess you and obtain consent for surgery. You will have your blood taken for testing, will have a chest x-ray and an ECG. You may require dialysis before transplantation. You will also be seen by an anesthetist on the ward. You will be instructed not to eat or drink anything until your surgery. Once in the operating theater, the anesthetist will put you to sleep. You will have a tube line placed in your neck vein and also a needle in your arm to give you fluids. You will also have a catheter in your bladder to monitor your urine output. You will then be positioned on the table in preparation for surgery. Sometimes it may be up to an hour before the start of actual surgery. The operation of renal transplant is performed through a 15 to 20 centimeter cut just above your groin crease. The surgeon on the day will decide which side your kidney will be placed. The blood vessels needed for transplant are the ones which take blood to and from your leg and pelvis. Renal transplantation is a straightforward operation. Once your blood vessels are prepared, the kidney is taken out of the box. The vein of the kidney is joined to your own vein first. Next, the artery is joined to your own artery. Once the blood vessels are joined, the surgeon will take off the clamp to allow your own blood to flow through the kidney. Often, the urine can be seen flowing out of the kidney once the blood flow is established. Once the surgeon is happy with everything, he will join the ureter, which is the urine tube, to your bladder to complete the operation. Your wound then will be closed with the stitches running under your skin. Occasionally, you will have metal clips to close your skin. 1 or 2 drainage tubes will be placed inside the wound to allow any fluid to drain out. After your surgery, you will be taken to a recovery area in the operating theater. Here you will stay for 1 to 2 hours until the nurses are happy for you to return to the ward. The duration of your hospital stay varies according to the type of transplantation. On an average, it is 1 week for a living donor transplantation and about 10 to 14 days for a deceased donor transplantation. Part of this time is taken for physical recovery from the surgery and part to fine-tune your kidney function and the medication. You will be given a push-button control for your pain relief for first 48 to 72 hours, after which you will be started on tablets for the pain. You'll be allowed to take sips of fluid and drink soon after the operation and may be allowed a light snack within 24 hours after surgery. This is in addition to the drip, which is expected to continue for 2 to 3 days. You will be expected to sit out of your bed after 24 hours and take a walk on the 3rd or the 4th day. The drainage tubes will be removed after 24 to 48 hours and your catheter will be removed after 5 days. You'll be started on anti-rejection medication following your transplantation. In addition, you will also receive antibiotics to prevent infection following the operation. You will not have completely recovered at the time of discharge from the hospital. You will require pain relief well into the 2nd week after your transplantation. You will also require more rest than usual. We advise you to remain active in between the periods of rest. Most people start feeling back to normal towards the end of the 2nd week. Return to physical activity, exercise, driving, and return to work are dependent on many factors, such as speed of recovery of renal function and absence of any problems. Work requiring intense physical activity may require more prolonged recovery period, sometimes up to 2 to 3 months. We advise you to ease back into your job by doing fewer hours at first or altering the nature of your job. We can't advise you of a start date for driving, but a sensible approach will be to have a few short drives first to assess. You should not be requiring strong painkillers and should feel confident to apply emergency brake should you need to. Your follow-up will be intense in the first month with clinic visits and blood tests 3 times a week. This will ease following the first month as the function of your kidney stabilizes.
For the pros and cons, we're going to talk about the trial was that was made to prove the effectiveness of this procedure. The pilot trial wanted to determine the safety and efficacy of transplantation kidneys from HCV genotype 1b retic donors into HCV negative patients followed by the pros. This procedure is a new path into the right direction to help patients with total renal failure, adults who were undergoing dialysis and who had long anticipated waiting times for kidney transplanted were eligible in the trial. Cons. The trial showed that one recipient had delayed graft function and proteinuria was developed in one patient, and after 3 days of the transplantation, one recipient had HCV genotype 1A infection, but no one had identifiable NSS5A resistance. For the sake of the trial, we have to say that all recipients were cured of HCV. A cure was defined as sustained virologic response 12 weeks after the end of the treatment. Now there is supply in Ecuador. In Ecuador, the annual donor rate in the country has increased in recent years. It currently reaches 7.76, that is an additional 2.71 compared to 2017. Likewise, in the last 12 years, a total of 5,454 transplants have been performed, of which only in 2018 there were 714 transplants.
You've had a blood test called a hepatitis C antibody test, and the test has come back positive. This means the test found hepatitis C antibodies in your blood. At some point, you've come in contact with the hepatitis C virus. Hepatitis C is a virus that lives in the blood and can have serious effects on your liver, even causing cancer. Around 1/4 of people clear the hepatitis C virus on their own. Unfortunately, even if they do fight it off naturally, they can get it again if they put themselves at risk. There is no immunity to hepatitis C and no guarantee of being able to clear it a second time. Your doctor or health worker will have to do another test to see if you have the hepatitis C virus. This is called a PCR RNA test. If this test is positive, it means that you have the hepatitis C virus, and without treatment, it will be there for life. They will also discuss with you about when you think you may have contracted the virus.
So what will happen to me?
Most people living with hepatitis C don't feel sick for a long time, but slowly, over many years, they may get tired, run down, and unwell. This can make life a lot harder to live, and sometimes is very serious, even deadly. The good news is there is now a very effective cure that you can get from your doctor. There are new treatments to cure hepatitis C, and around 95% of people on treatment will be cured. Just be aware, even if you clear it or it's cured, you can still catch it again.
What is the treatment?
For most people, all it takes is one pill a day for 8 to 12 weeks and a few simple blood tests along the way. It's very important that you take your treatment every day until you complete the course. Unlike previous treatments, there are very few side effects. During treatment, your doctor or healthcare worker will do a blood test to see how you're going and if it seems to be working. After 8 to 12 weeks, you'll have finished your medication and you'll have another test which we hope will confirm your hepatitis C has gone. The doctor will want to see you again a few months after taking your last tablet. There will be another test called an SVR test. This is the most important blood test, as this is the one that tells us if you're cured. But remember, this is a cure, not a vaccination, so you can get hepatitis C again if you put yourself at risk. If you become reinfected, that does not exclude you from further treatment.
How do you get hepatitis C?
Hepatitis C is only passed on through blood-to-blood contact. Most everyday activities do not pass blood from one person to another. Just living, working and being around people who have it is not a risk. The most common way of passing on blood is by sharing any equipment used for injecting drugs. And you can get it from using unsterilised tattoo and body piercing equipment, or sharing razors and toothbrushes and ceremonial tools. So basically anything that passes infected blood from one person into another.
How do I stay healthy?
To make sure that you're cured, you must take the pills every day for the time your doctor says and have your blood tested when it's needed. Stay in contact with your doctor or healthcare worker. They're here to help you follow the treatment and answer any questions. Don't share anything that can pass infected blood from one person to another. And we all feel better when we eat well, exercise and cut down on the grog. Your liver will thank you for it. You can always call the people at Hepatitis WA on these numbers. And remember, there's always care and support for you when you need it.
Now, for a conclusion, this is a revolutionary method which seeks to give a new option to patients without functional kidney. The pilot trial showed that transplantation of HCV genotype 1 infected kidneys into HCV negative recipients, followed by the use of direct-acting antiviral agents, can provide potentially excellent allograft function with a cure of HCV infections.